Hello, history books. My name is Doc Holliday, and I want to get on here and talk to you, talk to the American people, talk to all of those that are going to be writing about the conundrum that was COVID-19 and how it was able to wreak havoc upon the American population. I want to draw particular attention to Donald Trump and a lot of his constituents, some of his Trumpers or MAGAs, Trumpers, I think, Trumpers, MAGA people. I want to draw particular attention to you because of the fact that many of you are going to be wondering what was the reasons why so many of your friends, family members, have perished as a result of COVID-19. And I'm talking particularly to the white community, the white racist community, because of the fact that that your emotions, the emotions of the racist white American, was the exact thing that your President Trump was able to manipulate into getting the things that he wanted to have done in order to save his reelection chances. And the thing that he wanted to have done was to make sure that the economy is operating on all cylinders. He knows that if it's a strong economy, that the president is a lot more likely to be repeated or have enough votes to repeat or win the following election. Whereas if the economy is bad, he would likely stand a much harder chance of being reelected. So modus operandi, or the number one motive was to get the economy open at any means necessary. So what did President Trump decide to do? President Trump decided to pull the race card in order to do it. And the way that he did that is he somewhat correctly asserted the fact that African Americans are dying at a much higher rate than their white counterpart, and that minority communities were dying. The minority being Black and Latino communities were dying at a much higher rate because of their predispositions to poverty and other socio-economical factors that would have them a lot less likely to receive adequate health care in order to protect themselves or keep themselves alive. And the fact that, a lot of with their bad diets and everything, with the pork and grease and all that stuff, and being obese, many of them, that is the reason why the numbers are so high, is because that the coronavirus is killing a lot of Black and brown people. And that was the message that the government, all of the federal government, from the White House, all of the Republicans and everything were espousing religiously. Anybody that spoke up, stood up to the podium, whether it was Kushner or the vice president or the president or any other medical staff and everything. They're just like, oh, well, we're very concerned about the inner cities and the high propensity of African Americans and minorities to be susceptible of this virus. And all of what that basically did was tell the white people that we don't have to worry about this stuff. It told the racist white people, we don't have to worry about this stuff. We don't have to worry about COVID. Why the hell are we so shutting down when it ain't the white people that's dying? It's the black people that's dying. They're the ones that are having all these problems in the inner cities and with lack of health care and all this other stuff. The white people got plenty of money. We can take care of our own. Hey, get this economy back open. We don't want to be poor like the rest of the black people. Hey, get this economy open. So they began to protest. They took to the streets. They went to Michigan with their guns in tow and tried to intimidate the Michigan governor, Governor Whitmore. And I salute you, sister, because you've been doing you're doing your best to try to limit the casualties or limit the amount of people that were to could contract the virus. So I definitely salute you for everything that you were trying to do there. More power to you. I love you, sister. I love you. I love you. I love you for what you did, what you were doing. But you had those that were trying to do anything that it can. They had protests after protests nationwide trying to reopen all of the economies. You had the president, they need to open up all the economies, well, those Democrats, they're trying to do this to win the election, to get the vote. This is all a Democratic ploy, rouge. There's no virus and anything going on. All this stuff. He was placating to the racist white people, and all they was hearing is like, there's only black people. Why the hell are we closing? We need to open up. We don't care about them black people. Open up the economy. We don't care about them Mexicans. Open up the economy. We need to have our fun. We need to be on our yachts. We need to be spending money. We need to be doing making money. We can't make our money if we're staying at home. And this type of stuff just goes on and on and on and on and on. And until eventually they decided to open up the economy. Open up the economy, and you're probably seeing like 40, 50,000 people max, coming out with the virus, maybe 60,000 max. But as more and more states decided to open up, more and more states, were then left susceptible of increasing the coronavirus count. And as of right now, you would see exponential growth from the time of a couple of weeks ago, not even a month ago, until we're at right now. I'll just show you real quick here. Looking at some of the numbers, we're looking at right now, Texas, 19,000 new cases. California, 18,000 new cases. And one day, this is one day's total. This was the total from yesterday. This is almost 20,000 new cases in Texas and California alone. 20,000 in a day for those two states. Here we have Florida and Illinois and New York on the cusp of 10,000 per day. Oh, and there's more. So then you have Pennsylvania, Ohio, all of these states. These are all highs that they have had. All of these are all highs that they have had throughout the entire epidemic. We got 203,737 new cases that were identified yesterday. We have and that's like 3 times what we were at, and the 60,000 high when we first tried to shut down the economy. Now we're 3 times that. Then you have the death totals, and we're like 3 times the death totals. It was about averaging 900, maybe 1,000 a day. Now we're at 2,300, 2,800, which is triple where we're at just a month ago. Now, then I want you to take a look at the fact that we have 41 states. Actually, we have 42, including Puerto Rico. Oh, actually, no. Puerto Rico has under 615. All right, so we have 41 states that have that yesterday had over 1,000 cases, new cases for the day, for the last 24-hour period. 41 states had at least 1,000 people to contract the virus within the last 24 hours. That is, if I'm not mistaken, a new record for the amount of states that had at least 1,000 cases per day. And because I think last week we were around 35, 36 that we're getting, that were averaging, or that was getting over 1,000 of them a day. But now we're at 41. And we're likely to continue to grow and grow and grow because of the lack of policies, the lack of preparedness that a lot of people are having. The lack of preparedness, number one, meaning that a lot of people are not upgrading their masks. Everyone should upgrade their masks. No one should be relying on these masks to protect them and their life. No one should think that these 50-cent pieces are going to do anything to protect you. They are not. They may appear that they are going to do something, but this is the bare minimum of protection for you and catching the virus. What you need to have is the maximum protection that you can have. This filters out everything, 100% of all air. So when you're out there in the environment, whether it's working or grocery shopping or what have you, you are inhaling, exhaling everything out of this filtration system. And that makes sure that 100% of everything that you're inhaling is virus-free. That is what we need to make sure that every American, every citizen has, because we are yoked in the COVID-19 essence like crazy, and we have to do the best that we can to prevent ourselves, to prevent each individual from catching the disease. While I'm on that subject, it would be advantageous for the oncoming administration to prioritize not receiving or not catching the coronavirus, not prioritize not transmitting the coronavirus, but not contracting the coronavirus. Therefore, we would have more people doing more greater things to protect themselves and prevent themselves from contracting coronavirus, and thus they would want to protect themselves by buying a device to protect themselves from catching the coronavirus, which this is. Most people are not going to be wanting to spend money to protect other people from contracting the coronavirus. That is why you don't see people spending more money to buy better masks in hopes of protecting other people. If we, as the elective officers, whether it be presidents, congressmen, governors, mayors, city councilmen, any kind of legislator, if we can convey to the public that we want to have you all to prevent the virus from yourself. We want to prevent yourself from contracting the virus, from being from contracting the virus. We want you to have a better mask that will prevent you from doing that. That will prevent you from contracting the virus, being that this mask filters all the air that you would be receiving or that you would be inhaling to prevent you from catching the virus. The goal that we need to have for every American is to prevent yourself from contracting the virus. Once we adopt those policies or that policy, we would then have people mentally much more prepared to do what is necessary to protect themselves. A lot of the reason why you see people only having the mask up to here is because they feel as though they're doing something that they don't want to do because the authorities are trying to protect other people, and they are not making that connection, the mental connection that what we need in truth, and then each individual needs to do is to prevent themselves from contracting the virus so it would not be able to spread to anyone else. And thus they would say, okay, I need to protect myself from containing the virus. Maybe I should put the mask above my nose because most people would want to do things for the betterment of oneself. Most people, though this is a new generation that we have that seems pretty susceptible of doing things that would be more detrimental to their health as opposed to doing things that are for their health or more advantageous to them and their development. So that being said, we are still in the throes of a very ugly situation. Yesterday, we had 2,800 people that died as a result of the coronavirus. Tomorrow, not tomorrow literally, but in the coming weeks, we will have totals that will be reaching 5, 6, 7,000 people that would die each day because of the coronavirus. It is going to get very ugly before it gets better. It is going to be very, very ugly before it gets better. And a lot of this is not going to be visible to the American people as it was earlier in the pandemic, because a lot of the things that were the central place for it was at one of our media hubs, which was New York, and then followed by LA, and then Florida and Texas. So you had all of these places that had a lot of news media that could do a lot of reporting. Well, in the next couple of months, it is going to more dramatically affect a lot of the more rural areas, and it is going to not going to be in the public eye as much because there isn't as much of a news presence in those rural areas. But the carnage is going to be massive. The carnage is going to be very, very massive. Again, 5, 6, 7,000 people are going to be dying a day here in very short order, unfortunately. And I want very much for you not to be one of those people. I do want you to, again, number one, like, share, and subscribe so that other people can be benefited or can benefit from these from the things that I'm telling you. I also wish that you can actually share it, literally talking to people, your neighbors, your family members, and saying, listen, I talked to this, or I looked at this video online that gave me information about upgrading my mask. I think that it is very valid information. I think that it would be beneficial for you to listen to this video or watch this video, and refer the video out to a lot of your friends, your family, and make sure that they watch it. Make sure that they understand that in order for them to live through this COVID-19, that we have to do more than what the government is telling us to do to protect ourselves. Because if there's anything that we know or have learned from the past 4 years, it is that our government, we cannot count on our government to do what is best for our nation. And that a lot of times we're going to have to allow, or we're going to have to um, uh, uh, allow other people to have the voice in order to save it. I think I messed that up, what I was saying. But the basic thing is, I hope that you all believe me. I hope that you will share with others, and that others believe me. Um, we have to upgrade our mask. This virus is a very serious thing. We are still set. We are still on track to having 1 million deaths, 1 million deaths by April the 1st. I'm going to say again, we are on track. The United States is on track to having 1 million deaths by April the 1st. If we do not get more prioritized in saving ourselves, we could possibly look at having as much as 3 million people perish. That's 1% of the population perish as a result of COVID-19 by the end of next year, by the end of 2021. We could have as many as 1 million people, as many as 3 million people die from COVID-19 in the United States alone. That is 1%, just under 1% of the population. We are at risk of just under 1% of the population dying from COVID-19 by the end of the year. We are definitely very likely to have 1 million people dead as a result of COVID-19 by April the 1st. And unfortunately, it is going to be a very messed up April Fool's Day that we could ever imagine. But yeah, it is basically because of the racism that 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 America still has within itself. As I mentioned, it heard the news that it was more minorities that was dying from it. So thus, white people didn't have to worry about the disease. And thus, it was all calls from, especially from Republicans, to open up the economies. Everything would rely on personal responsibility. That you don't need to lock down the whole society. Um, every person, just because they have a voice, doesn't mean that they are suitable to be leaders or suitable to be heard on matters that are very vitally important to not only individuals' lives, but a community or a state or a country's life. Not all people are possess the intellectual capacity to be able to ascertain what is the best thing to do. That's why not everyone can be a leader. Um, we have the the number one person that should not ever have been a leader of anything, Doctor Donald Trump. Um, um, Doctor, ain't that true? I don't know where I was going with that one. But you cannot believe people just because they are in the position of power that they are truly putting the best um, foot forward to actually, in terms of actually facilitating their jobs. Um, and some of them may be just very ignorant about a lot of things, but some of them are very evil and deceptive in their ways. And I would vote more so on the latter, as far as well, they have a little bit of both because, especially with the president's terms, he had a little bit evil and a little bit of deception in it as well, because he wanted the economy open. Um, so, again, this is where we're at right now. Now, in terms of fixing things, what we have to do is have people stay home from work, close everything down like we did before. Don't open anything back up until you have all of the numbers below 1%. Um, and that would be even for like California and Texas, since your populations are so big, we probably even wanted to go at like 0.5%, because 1% of the population for Texas is like 120,000 people, and 1% for oh, I'm sorry, no, for Texas is 2.8. Yeah, that's 290 million people. Sorry, 290,000 people is 1% of Texas population, and for California, that is 126,000 people. So, if you were just to make sure that your numbers were to get um, under the 1% before you open back up, it would still be too many people that would prevent the your how do you say your contact tracers from being able to do an adequate job, because you wouldn't be able to contact trace 126,000 people in California and 290,000 people in the state of Texas. That's just not feasibly possible. So for these larger states with the larger populations, you may want to adjust it down to like a 0.5% before you are to open up. And again, the reason for that is because of contact tracing. But now, as far as things opening and closing and all that stuff, again, all the businesses should be closed. All of the schools should be closed. They should be doing distant learning, and not to go back to brick and mortar until the virus is taken care of. I understand that a lot of people are um, scared about their son, or they need child care and all this other stuff. Um, you know, uh, I would, I don't know. I don't know what to tell you. Unfortunately, we are at very hard times and trying times, and in order to save our nation, we have to buckle down a little bit more. And unfortunately, the politicians didn't get stuff done right the first time. That doesn't mean that we just say, okay, well, we can't get the thing right, and so we're not going to do anything to get it right. No, we have to regroup, re-strategize, get different leaders in there, and execute a game plan in quarantining everyone, getting the virus back down to under 1%, and then doing adequate contact tracing, and hopefully having a true candidate for vaccines, as opposed to any kind of rush development to get an actual vaccine, um, and um, and make sure that the vaccine is, number one, safe and actually um, effective in preventing someone from catching the COVID-19. Because as of yet, we have not received any documentation as to how many, in fact, how many people that participated in those studies, how many of them that were given the placebo plus the vaccine, how many of those patients were actually came in contact with COVID-19, because as you already know, they the manufacturers did not purposely give the participants, once they got the placebo or the vaccine, the drug manufacturers did not give the participants or expose them to the actual disease themselves. They instead directed them to go back to their home lives, um, and based upon their home lives, how they how prevalent the disease is in their homes or their communities, they would uh, you know test them every month or every quarter or what have you, and if they were to develop any kind of symptoms, um, or were to catch the virus, they were to document everything down, and give it the information to the testers or to the manufacturers. But the thing is that um, you know we don't know, out of the 30,000 people or 60,000 people or 20,000 people that were included in the study, the program participants, we don't know if how many people were infected with the disease. We don't know if or exposed to the disease. We don't know if there were 10,000 people that were exposed to the disease, and thus there was 9,990 of people that that the vaccine actually worked for. We don't know if it was 1,000 people and there was 900 or so people that are known, of which the virus actually repelled the vaccine. Sorry, actually repelled the virus. Um, we don't have that information. We don't have the information as to who was actually exposed to the virus, because it could very well be that it was 67 people that was exposed to the virus out of that 30,000 people that were included in the test, and that 67 people that were exposed to it, 60 of them were, or that came out with the test, 60 of them were of the placebo group, and 7 of them were from the non-placebo group or from the vaccine group. And that would mean that those vaccines would not be good, because um, if there were only 7 people that were exposed to the virus, and each of those 7 people actually got the virus, that would mean that uh, vaccine is actually 0% effective, because for all the people that which got uh, uh, exposed to the virus actually did come down with the virus, regardless of whether or not they had a placebo or the actual vaccine. And since we don't know how many more people of the test actually got exposed to the virus, we cannot then derive that the vaccines are 95% effective. We can't derive that information. There isn't enough information to make a proper um, uh, definitive statement, because again, we don't know how many people were exposed to the virus, um, and that is one of the basic premises, or you know, that is one of the constants that has to be known in order for the scientific study to be valid. So, you know, there's that. But I'm going to let you go. So again, please do upgrade your mask. If you all have any questions or concerns, if you need me to come and talk to anyone, I'm definitely here for you. If you are struggling right now, if you are, financially in constrained times, number one thing that you want to do is protect yourself, protect your mental well-being. Um, try to do things. Well, number one, try to do whatever you can to get a job that would not require you to be out in the public. Number two, try to do things that are stress relieving for yourself, whether that be listening to some music, or going out and exercising, or um, partaking in the greenery of things, swimming, all that stuff. You can still go do, um, despite the fact that you have some struggles and everything going on. Try to make time. Make sure that each day, or as much as possible, you take time to nurture yourself, to do a self-assessment as to how you're doing right now, and make sure that you don't allow yourself to be too stressed, or fall victim to this unfortunate situation that we're faced with. Um, I would implore everyone to try to get a closer connection to God. I would, in terms of music, getting like some religious music. We're in a holiday season right now. Even some seasonal holiday music would be appropriate as well. I would try to stay away from the rap and like heavy metal and stuff of that nature. I would try to do a lot of repenting, try to get closer to God, and you know, through you getting closer to God, He will make this harsh journey that we are all on a lot easier to deal with, and to enable us to get enough personal strength to continue to fight on and not be affected by the many things that are out there in the world that one could be discouraged by, because of the current environment that we're living in, the social, political, economic environment that we're living in right now. So, exercising, going out, getting your bike and go take walks. Bike rides. You can go take walks as well. Also, I would say taking like Tai Chi classes would be a good thing. You can even look on video or on the internet, and watch different YouTube videos and everything of how to do Tai Chi. You can decide that you want to, um, you know, uh, take up music. That was, to be honest, that's one of the things that helped me when I was struggling, or was going was music. When I was going through some things, somebody had gave me a radio to listen to, and I knew right then and there, I was like, oh man, thank you, bro, because this has just helped so much. Because I just knew that it was going to be able to lift my spirits, and it did. And I know the same can be said for you all. I know that right now a lot of people are in the watching TV vibe of things, and flipping through channels to get a sense of fulfillment from the TV. Well, um, while thereby forgetting the sense of entertainment that we get from the radio and from CDs and from songs, from music. Um, Heck, you can even, watch a lot of YouTube videos, but make sure that it is of a nature, a music of a nature that is going to put you in a positive place, not something that is going to be detrimental to your mental psyche and have you doing stupid stuff or being and more impulsive or angry than you were prior to you know, putting on the music. Anything that you're trying to should just be just fun, just vibing, just clearing, just just you know, allowing you to get closer to yourself. Uh, whether and that can be done through meditating, through yoga. Um, there are a lot of things that can be done or that you can do to put your mental state in a more serene place to where it would not be to where you would not allow yourself to be stressed to the point to where you know it could start affecting your mental um, and that can affect your mental and have you going all the way down to eventually killing yourself, which is again something that I definitely don't want to have happen. And the unfortunate thing is that there are many, 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 many people committing suicide every day because of the personal situations that they are dealing with, and the lack of ability of have a lack of ability to deal with those situations or a lack of clarity to of how to deal with those situations. But um, I think that the more that you can find yourself having the mental clarity while going through some very painful or tragic events is the most beneficial for you because unfortunately there are going to be many more tragic events happening in the next few months. Um, as they had mentioned before, as I mentioned before, it is going to be a very dark winter here in the U.S. because of this coronavirus. But um, you know, I want even though we have this troubles going on, I want everybody to still um, have faith that we are going to make it out of it. Have faith in God that He is going to put forth the answer, and have faith that one of those answers, some of those answers, was provided in this video and other videos that I've done previously. And I hope that everybody is really, um, looking or watching those videos and sharing those videos um, because it's going to help a lot of people. A lot of people. So, um, you know, there's that. So that being said, I'm going to go ahead and check out. Um, Again, people, please be safe out there. Please wear your mask at all times. I even just yesterday, I think the day before, I messed up myself of going over somebody's house. I even had my mask with me, but it, I just felt comfortable in going in their house, and like everybody feels that way, but we have got to remind each other to not do it because people are dying. I don't know if that person, if that family has contracted COVID. They could have went. Somebody could have visited their house 2 days ago and had COVID and exposed them to it, unbeknownst to me, and they could be carriers of it. And I could have went in there and actually caught the virus from them 2 days ago, and I could be affected of it, and it could sprout out to the full-fledged thing in a matter of days, all because of one simple mistake of me not wearing a mask. I had the mask, but had I worn it, I would not be in a situation of possibly losing my life to COVID-19. What I hope that everyone in America could start doing now is learning from the mistakes of the 14.3 million people that did not wear the proper mask, that did not wear a mask when they went out to visit their friends. We all have to drill it in our hands right now, because we are in a state of war. If we go outside and be around different people in our community, the virus, the thing that is causing so much destruction in our lives, can, as a result of me being out and socializing with other people, can then attack me silently, and thus attack my family should I be infected and bring the infection back home to my loved ones. So I say that again to remind you all that each one of us can make mistakes, but we have to stop making the mistakes as much as humanly possible, because our lives and our future depends on it. So please learn from my mistake. Please learn from the mistakes of others, because I don't want more lives to be ruined needlessly because of the fact that we did not take the virus plague serious enough to give it its proper respect and understand that this is something that is very deadly and will leave you lifeless if you were to contract it in a matter of days. It is really that pertinent of a situation. America, you are very steeped. You're steeped into the coronavirus right now. We all have to do better. And being that we all suffer from doing things of our free will, it is because of that why it is necessary for governors and presidents and mayors to put in stay-at-home orders, because of the fact that with our free will as human beings, especially as Americans, we are doing everything that is the wrong thing to prevent the virus. We are in fact doing everything to spread the virus, and contrary to containment. We can do better than this. We must do better than this in order to save a great many people. Because as I mentioned before, we got, by the end of the next year, about 2.7 million people more to go that we're going to lose. We're going to lose 1 million people by April the 1st. We're going to lose 1 million people. We already have almost 280,000 people that are dead right now because of COVID. It is going to ratchet extremely up. We are going to have cases of 4, 5, 6, 7,000 people dying a day from COVID. I hope and I pray that 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 more city and state and leaders will do what is necessary to lock down everyone, and also do what is necessary to make sure that no one is kicked out of their house, their apartments, or their homes because of non-payment of utilities um, or rent or mortgage bills, because there is no work. Right now, we need to be taxing all these corporations, all these millionaires that were so insistent on reopening, and so that they can get their pockets fatter, while at the same time, as a consequence of reopening, has made the impact of the coronavirus extension, exten, ex, extensively worse, exponentially worse. And it all did not have to happen. Drop it down to 1%, below 1%, especially in states like California and Florida and Texas, all the ones that have super high populations. It has to go down to like 0.5% or something. It has to be low enough for the contract tracers to do their actual job, and for it to be effective. We all have to upgrade our masks to make sure that we do not catch the coronavirus. And we all should be downloading the app, like a virus tracker app that should be operated by the CDC and FEMA. To Everyone should be downloading it, and it would help to alert people if they have been exposed to the virus. It would be basically a tracker to let you know, okay, if we find out that your boss was infected, was diagnosed with COVID-19, it would then send out a text for everyone that your boss was around or happened to, whether they were in a meeting with them or they spent any time around them. They would be then contacting those people and saying, hey, you've been exposed to such and such's boss last week, or over the weekend, and he is now tested positive for COVID-19. As a result, it is possible that you too may have been exposed. And what we would like you to do is, number one, to isolate yourself as soon as possible, and go and get a test for COVID-19 to see if you actually have it, and continue to do those tests for the next week to 10 days, and to make sure that you do not come down with the disease. Once those 10 days are over, then you can go ahead and come out of the quarantine. But we are going to have to do a lot more to provide sustainability for our families, because we have to now um, uh, be locked down for that much more longer in order to in in order to if, effectuate the desired outcome, which is reducing the amount of positivity, again, to a number of which the contract tracers can do their jobs. Um, and I don't know. I can go on forever, but I'm going to stop it right now. Thank you all for listening, for subscribing, for liking, and for sharing this video. I hope that I will be able to continue to do these videos and for longer. I am hopeful that we don't actually reach the 1 million milestone. I am hopeful that everybody sees this video and says, okay, I'm going to upgrade my mask and make sure that I take personal responsibility for the health, for my health, and I won't just allow myself to be a victim by relying on a inadequate protection um, to stopping the spread of the virus. Because remember, of the 14 million people that have the virus or had the virus, and of the 280,000 people that have passed away from the virus, it's been estimated that 70% of those people actually have been wearing masks. So that would be, 10 million of those people were actually wearing masks, and they still caught the virus. But the masks that they were wearing were the cloth mask or the surgical mask, which again, um, they don't do squat to stop the coronavirus. But by all means, do your own research. Um, Look and see if what I'm saying is making sense or is supported by actual evidence. Um, and just take a, just take a serious look um, at what is going on in relations to coronavirus. Um, I definitely am a person that does not lie. I hope I don't have any motivation to lie about any. I'm gaining nothing by well, I'm gaining the fact that you guys are living and staying alive, but personal gain, other than that, there is none. So I really do hope that you all understand that this is coming from a very pure place, because one of the things that I think is purposeful for my life is to be a leader and to lead people into the right direction. Lead them to Christ, really, is really what I feel as though my calling is. Not to say that I'm like a preacher or or, or the next God or next Messiah or anything like that, but I know that I am a guide for people. I know that that is the thing that has been blessed upon my life, um, and I want to hope that you will allow me to be um, such a leader, and I hope that you will respect the words that I'm speaking as words that are coming from someone that is trying to lead and be a leader and to help you to succeed and help us to make it through on the other side of this catastrophe. Um, but other than that, I don't really know much else to say. But please don't send your kids back to school. The school system has no way of protecting your kids from the virus. Keep them home. Homeschool them. Don't lose your kids. Don't allow your kids to bring the virus home to you and your kid end up losing you. But other than that, God bless y'all. I love you. Keep the faith, baby. We're going to get through this. Peace and love. And internal gratitude and all that. Oh, gosh, I really hope people are getting this. But I got to go. Thank you.